So on that note, everyone, welcome to the Idaho Clinicians for Climate and Health and St. Luke's Sustainability Climate and Health Lecture Series. It's a lovely afternoon here in Boise, Idaho, and thank you for joining us. We have an outstanding speaker today for our last lecture of the series, Dr. Gaurab Basu. Dr. Basu is a primary care physician and the Director of Education and Policy at the Center for Climate Change, Health, and the Global Environment, the Harvard Chan Sea Change program at Harvard T.H. Chan School of Public Health. He is an instructor at the Harvard Medical School, and his work focuses on the intersection of climate change, global health equity, human rights, medical education, and public policy. Dr. Basu has developed and evaluated numerous innovative healthcare curricular programs. He's the director of the HMS Climate Change and Health Curricular Theme, co-founded the CHA, Cambridge Health Alliance Center for Health Equity and Education and Advocacy, co-directs the HMS School Social Medicine Curriculum and the Climate and Health Organizing Fellowship, which I took with him last year and helped me a ton in my climate health journey. We have another Idaho team that's there with him coming up this year, and we're really excited to continue that partnership. Gaurab serves on the Education Committee at the Salita Institute for Climate and Sustainability at Harvard University and received the inaugural HMS Equity, Social Justice, and Advocacy Faculty Award and the HMS Charles McCabe Faculty Prize in Excellence. He has been an HMS Curtis Prout Academy Fellow and a Harvard Macy Scholar. In 2021, Dr. Basu was named to the Grist 50 list of national climate leaders. In 2018, the Robert Wood Johnson Foundation named him a Culture of Health leader. He serves on the Implementation Advisory Committee in the Massachusetts Governor's Executive Office of Energy and Environmental Affairs and was part of the Cambridge Mayor's Climate Crisis Working Group and its Net Zero Climate Task Force. He's been featured on NPR's All Things Considered, the Boston Globe, Scientific America, the BMJ, Grist, amongst others. Dr. Basu previously worked for numerous global NGOs, including the Gates Institute, Partners in Health, the Child in Need Institute, and the Last Mile Health. He's on the board of directors for Physicians for Social Responsibility and the Weather Channel's climate program, Pattern. He is on the advisory council of the Environmental League of Massachusetts and served as one of the clinical leads of the Cambridge Health Alliance's COVID community management during the pandemic, which unfortunately has struck me down today, which is why I'm presenting from home as opposed to presenting in person with Stephanie and Sarah. A special thanks before Gaurab takes over to Michael Hobson, Sarah Hegerly, and Stephanie Wicks, as always, for helping coordinate and present this lecture series. We've got an exciting lecture series lined up for 2024, which is hard to say because I can't believe it's already 2024. But now I'm going to turn things over to Dr. Gaurab Basu.
Ethan, thanks so much for having me, and thanks for the introduction. And Ethan and his team, and now our new Idaho team, have been really just terrific partners, and know that you all are hard at work and really understanding how to incorporate climate solutions into healthcare in across the state of Idaho. So it's been really nice experience for me to get to learn more about the issues and the opportunities within your state. It's a real pleasure to join you all. I've seen this lecture series, a remarkable lecture series, so I'm really humbled to be a part of it. But Catherine Hayhoe and Dr. Frumpkin, I think, Ethan, that was another speaker, are real legends to me. So know that you've had some great opportunities to engage with leaders in this space. Let me ask before I start, Ethan, will I be able to hear the audience in the room if they chime in? It might be hard. They want to.
No, so there's a very limited in-person audience, and most of the audience is online. And
okay,
the way the platform works, it's all going to we're separate from them in terms of.
Okay, got it. Okay, because I was gonna ask a few questions. Is there, do you see any chat function where people are chiming into the chat that would be seen, or we can do it a different way also?
Sarah and Stephanie have the moderator view, so in the room they can collect questions and answers.
Okay, yeah, I might ask, and it's fine if it's not working technology, but if our moderators wouldn't mind kind of giving voice to some of the comments that we're getting in, that'd be great. And I will say, Ethan, sorry, hope you recover quickly. We had a nanny snafu this morning, so the kids are downstairs. They may visit at some point. We'll see, but hopefully not. And Stephanie, I just, if I could share my screen, I can share my slides.
So Dr. Basu, there should be a share screen button for you.
Yeah, it says host disabled participant screen sharing.
Let us work on that for a moment.
We're trying to figure out how to enable your sharing, Dr. Basu.
As if it's like tagged, if you tag me as a co-host, it might help.
Yeah, I'm not sure. Oh, there you go. Your co-host. Yes.
All right, I got it.
Perfect.
All right, so hopefully you can see my slides there. So it's again in the next 60 minutes. My hope is to talk about some of the impacts of climate change on health and health equity. You all know much of this already, and I promised Ethan I would give some voice to work we've done in our home in terms of home electrification, a little bit on our journey there, and then hopefully have a little discussion. But I almost have a funny talking about climate change as an issue of health equity is it's almost just doesn't capture the whole thing. I don't think there's any other way to talk about this other than as an issue of equity. But this is, I think, a vehicle of talking about how do we look after each other? How do we take care of each other? How do we take care of this extraordinary planet? In so many ways, Idaho, has this understanding of the importance of the land and its relationship to the land that I think much of the country, much of the world is often lacking, and having that kind of deep relationship of understanding how our interface with nature impacts our well-being is really at the core of this. And I think there's a lot of lessons that we can be learning from Idaho. But this is where I was going to ask, and people can chime in as much as they'd like to. But I often start lectures by asking people if they could just give voice to the one word emotion they feel when they hear the word climate change. So if there's anyone who could kind of say that in the room or put it in the chat, and maybe someone could read those out, it'd be great to hear that. I'll tell you what emotions come to my mind.
We have panic.
Opportunity, anxiety, opportunity.
Coming together.
No.
Greater accessibility to better options. Overwhelming.
There's, what I'll say is for all of those, there's a bigness to all of those, right? There's that sometimes I still, I kind of live and breathe this stuff now and think about it all the time, but there's just a bigness to this work. And so I'm hearing some people saying, hey, this is an opportunity for us to come together, and other people saying that this is very overwhelming. And actually, I think, this spectrum of feeling very isolated and lonely and worried and scared is one part of it. And there's another vision of us feeling very connected to one another, very able to dig in together and to describe the opportunity and possibility of the kind of world we want to build. And I think we have to embrace that work. And the reason I kind of bring some of those emotions up to the forefront of a academic presentation is because the data is critical, and we'll go through some of the studies, many of the studies that you know already. But we really need action. We need people to and the fellows we've had from Idaho are just such extraordinary examples of people who are saying, I'm a healthcare professional. I know this impacts my patient's health. I know I'm worried about it for my own family and my own loved ones. And I got to put one step in front of the other. And I think that action orientation, that belief that we can do something if we work on it together is really critical. So I honor those. And I'll tell you, I feel a lot of the paralysis, fear. I really go on my own roller coaster of feeling all this. And trying to absorb the news of the day. Some days they're good. Actually, there was a joint statement from the U.S. and China today, and the weeks before COP about the possibilities of coming into COP with some new commitments to decreasing emissions this year. So that's actually really critical, good news. But there's been a lot of bad news, and that can really hit our psyche and make us feel helpless and hopeless. So I want to honor those emotions, but also say, how do we build community with one another and kind of dig into those values we have that is why we do our work, and how we can cultivate a vision of what climate action looks like through that work. So just to level set a little bit, again, I think many of you know this already and may have heard it from this lecture series already, but I didn't tell you much about, I was not working on much climate change work before 2018. My background's in global health work and health equity work and, background in human rights. And I'll be honest with you that until 2018, I wasn't fully appreciating how climate change was important. I thought, we got to get progress on this. It's really important. But, I remember a conversation with a college friend of mine 20 years ago saying, I know the environment's really important, but there's so many people struggling and suffering. We got to take care of people first. That was a real blind spot for me, to not appreciate the ways in which you cannot you cannot separate the health of our planet and the health of people. They're deeply intertwined. And it was very shocking, very abrupt. It was a lot of grief for me to really appreciate where we are in the impacts of climate change. And since 2018, which is when I had my kind of awakening, obviously it's more and more in the consciousness and more clear in the day-to-day lives in our country. But this UN report was the one that really woke me up. At that time, it said that we had warmed to greater than 1 degree Celsius from pre-industrial levels, that warming to 1.5 degrees Celsius was likely to happen as soon as 2030. You see that range, and actually, it's really suggestive now that we're going to probably hit 1.5 by that earlier phase around 2030. And to limit climate change to 1.5 degrees Celsius, we need to decrease greenhouse gas emissions 45% from 2010 levels by 2030 and reach net zero by 2050. So another way to think about this is we have to end all anthropogenic human-made emissions by mid-century and get halfway. In order to do that, get about halfway there by the end of this decade, which of course is much closer now that we're in 2023. So here's our carbon dioxide emissions over the last 62 years. You can see the bumps down for major kind of historical events, and more particularly for COVID, we went down 5%, but we bumped back up. And I think most consensus is that we've about plateaued. We're probably decreasing, we're probably having the same amount of emissions every year now. We're not increasing, but we're not decreasing, and that's not success, because we really need to be ratcheting down our emissions to get to 45% decrease of emissions. We got to be decreasing about 10% a year. So you can picture what that slope would look like compared to that COVID line. So we've got a lot of work to do. And oftentimes change doesn't happen till it happens. So we have not made as much progress as we should. But again, there's never been as much consciousness and activity on changing the trajectory. So who knows if the slope suddenly turns downwards very quickly. I believe that is actually possible. But urgency is clearly the name of the game here. I just want to level set to make sure that people know the kind of the sources of greenhouse gas emissions. 25% come from our electricity and our grid. 24%, interestingly, is from our food and agriculture, land use. Industry is things like steel and concrete and cement that causes a lot of emissions, of course, in the internal combustion engine and transportation causes 14%. And then how we warm our buildings through warming our water and warming our rooms and things like that is another factor. So let me just make the point that, I talk mostly about climate change, and that's how I think about this issue, but there's a few arms to this. Climate change is about greenhouse gas emissions. Planetary health really is what we should be talking about and really putting our arms around. And that's really talking about our ecology, thinking about things fully like deforestation and our food systems and biodiversity. So it's critical we wrap our arms around all the kind of intertwined issues in taking care of our planet, and planetary health really helps us do that. And environmental justice rightly puts the focus on communities of color, disproportionately harmed communities, and not only talks about emissions but also things about air pollution and toxins and chemicals that are really important to be evaluating and addressing in disproportionately harmed communities. This is the way I organize it, the 8 ways that climate change and the burning of fossil fuel impacts health equity. Many people organize it different ways, but this helps me just think about what's happening and how it's impacting my patients. So I offer it to you. Food insecurity, water scarcity, infectious diseases, extreme weather and natural disasters, heat-related diseases, air pollution, impacts on mental health, and forced migration, and even political conflict. And, we need to really be thinking about the social fabric, the kind of social stability, and the ways that climate change impacts our ability to serve. So let me tell you about a patient of mine. So this is the hospital I work at, or the hospital I'm connected with. I'm a primary care doctor in a community health center, but this is where our patients come if they need hospital care. So I had a 30-year-old patient with a history of asthma. He had moved to the United States 5 years prior from El Salvador. Back home, he was a sugarcane farmer, and he had developed some upper respiratory infection symptoms. So was feeling, a cough, felt like he had a virus, was trying to kick it off, but was increasingly feeling short of breath. And especially when he laid down, he was having orthopnea and headache and fatigue. He was really getting nudged by his family to get checked out, finally did. It had this really devastating diagnosis. So out of nowhere, really jarring, upending, tragic diagnosis of acute on chronic renal failure. And he came to the hospital thinking he'd just get some antibiotics, maybe had some pneumonia and be on his way. He was emergently hospitalized and dialyzed. And of course, his life changed forever. And he had no reason to think he was anything but in full normal health. And this really changed his life. So he didn't have diabetes, he didn't have high blood pressure, didn't have intrinsic renal disease. And so after a really extensive evaluation, he was diagnosed with many different names for it, but heat-triggered renal disease, or CKDU, chronic kidney disease of unknown origin, or Mesoamerican nephropathy. There's different terms that are used. And it is true that a lot is still being sorted out about the mechanisms. There's questions of whether pesticides or other environmental exposures are impacting this source of morbidity. But heat, my read of the literature makes me confident to tell you that heat was really at the center of this story. And so morbidity and mortality from this phenomenon is clear in Central America, in places like Nepal and other places. And it's mostly for outdoor laborers, and particularly for farm workers, which my patient was. And so what I feel confident saying is that my patient was out tending to crops day in and day out for about 15 years. And that he was in a very hot environment, and that he was getting dehydrated, that he was having pre-renal events. The perfusion to his kidneys was poor because of him being kind of exposed to severe heat day in and day out. And his creatinine was bumping up, his GFR was bumping down slowly but steadily. And unbeknownst to him, his kidneys were slowly deteriorating. And there was no reason for him to know that until he came into the hospital that day. Because he was compensating. But this really is the face of climate change for me, that we are having increasingly frequent and severe hot days, that people are put out in these exposure pathways without a real recognition of the ways in which dangerous heat is impacting them. Dangerous heat has been present in many of these places, but it's happening increasingly, and people are in harm's way. Our patients are in harm's way. And how we think about how the environmental factors impacting them, how we support them, how we communicate some of these risks is really a critical part of our work. And so I met this patient in 2018 when I told you I saw that UN report, and it really felt like the world was telling me I need to wake up and really understand this. And, I pride myself as a primary care doctor in knowing my patients really well, understanding their context, understanding where they work, where they live, things that could put their health at risk. And I had to really recognize that I had some real blind spots about asking them about how environmental exposures could be impacting their health. And the truth is, I still am working through how to integrate this into clinical care, because I think if you have a patient working in farming and that's their livelihood, and they don't really have an opportunity to kind of speak up for themselves or have occupational protections to make sure that if it is dangerously hot outside, they have breaks and access to hydration and shade. We saw what happened in Phoenix this summer. There's outdoor laborers now where they're asking people to start at 3 a.m. For work. And so it really has just challenged us to understand how we can live our lives in certain ways. The kind of heat waves have become quite dramatic at times, and it impacts all the organs we care about as health professionals. It increases the risk of strokes, heart attacks, your liver, kidney, every organ system we really care about. Our bodies do not do well if we're exposed to severe heat. This was a meta-analysis that came out of JAMA Open Network a few years ago, showing an association between air pollution and heat exposure with premature birth, low birth weight, and stillbirth in the United States. And then a subgroup analysis showed that Black people were disproportionately impacted for these obstetrical outcomes. So these are one of those studies that really keeps me up at night and makes me feel like this is undignified, that we would allow these harms to come upon the new generation, and that we have to act with urgency to make change. I also want to make the point here that heat and heat-related disease really touches upon so many issues. Climate change, the bigness of climate change, the ways it impacts health is, I tell the students I teach and work with that, you should keep being who you are, keep caring about the things you care about. If you are in medicine or public health because of mental health, care for mental health, well, let me tell you how climate change is impacting that. This was a study that was showing an association that folks on hotter days were utilizing ED mental health services significantly more, not only for mood disorder, but for schizophrenia, for substance use disorder, for suicidality, hallucination. So this is impacting mental health. Here's another study that previous study was out of the BU School of Public Health. This one as well from BU School of Public Health, showing that on very hot days, gun violence increases in our communities. And a further study, John's a friend of mine, further showed that if you increase tree canopies in communities that don't have it, if you increase shade, actually gun violence decreases. And can be considered a community level intervention for decreasing gun violence. So, structural racism is a framework that feels important to me to kind of really frame and outlet, to organize what's happening. Dr. Kamara Jones has defined structural racism as a system of structuring opportunity and assigning value based on the social interpretation of how one looks, such that it unfairly disadvantages some individuals and communities, it unfairly advantages other individuals and communities, and saps the strength of the whole of society through the waste of human resources. And so we have to ask ourselves hard questions about where is the fossil fuel stuff put. I live in Cambridge, Massachusetts, and just a few neighborhoods away is Chelsea, Massachusetts. And, the fossil fuel infrastructure is placed in Chelsea in a way that it is not in Cambridge. We have a certain lifestyle in the United States and built a built environment that's reliant on fossil fuels. We got wealthy off of fossil fuels, and disproportionately the global South is being impacted. Now they're getting so harmed and are saying to the global community that, hey, we did not put much carbon dioxide into the atmosphere, but we're still getting harmed. What does it look like to move towards a more sustainable future, and how we need help to build out a clean energy future and to mitigate and adapt to the impacts of climate change. And it saps the strength of the whole of society. I think that, it's put health at the middle of this conversation, with thinking about its impacts on infectious diseases and heat and air pollution and extreme weather events and food and water. The vitality of our society is sapped by continuing on with this crisis. To be a little more concrete about this, there's a study that came out a few years ago as well that showed a study of 108 redline communities. So there's really explicitly racist language in federal policy from redlining, saying that mortgage companies and banks did not need to invest into communities that were circled with a red line, and those communities were communities of color, immigrant communities, and those communities are 2.6 degrees Celsius hotter than non-redline communities. So we've got to think about how the lack of investments over 34 years of this policy and onwards into the future was pulling away resources that could green these communities, that could create vibrant civic spaces, parks, tree canopies. And instead, there's a lot of industrial space, industrial waste, and a more desperation to create economic viability that pull them towards accepting fossil fuel projects and infrastructure. So these 2.6 degrees Celsius is a lot. It's really critical for us to appreciate how dramatic these can be. This is just a schema from Jonathan Patz, who is a family medicine doctor in Wisconsin and has been a part of these UN IPCC reports. And it's a schema just showing, relative on the top, the disproportionate emissions from by country. You could see wealthier countries having a larger share of that. At the bottom is a modeling of the impacts of the consequences of climate change, especially for related disease with malaria, malnutrition, diarrhea, and drownings. And so you can just see here, how this is played out, that certain countries have put disproportionate emissions into the atmosphere and other countries are disproportionately being impacted. I'm not going to speak significantly to this today. I'm saying a few words about global impacts, but I just want to make the point and maybe reemphasize the point here that global health equity is really at the middle of this whole conversation. And, I kind of got this advice that, you shouldn't talk about, communities across the country and when we're talking about climate change and getting folks activated for this, you got to really have a local conversation about climate change. And that's true. We have to really explain to people how climate change is impacting the things they care about right in their communities. But I do think it's really important for us to understand and feel connected to the harms that are happening across the world. And, when I was a medical student, public health student, it felt, I had this privilege of getting educated here, and my parents did so much for me so that I can become a doctor and live here. But my parents had a very hard life and were in a lot of poverty in West Bengal, India. And so when I was a med student, public health student, I went back and started working with a nonprofit called the Child in Need Institute there. And in 2020, I remember reading this study showing the association between super cyclones and climate change. So the oceans are getting hotter, the vapor expands a different way, it doesn't move as quickly, so it dumps a lot of water, and these can become those kind of category 5 hurricane cyclones. And this study was really showing how climate change was a factor in this. So I read that study and then looked at a news article saying that there was cyclone activity in the Bay of Bengal. They were really concerned about where it would land. And lo and behold, 10 days later, it really wiped through Bangladesh, coastal communities in Bangladesh and West Bengal, in communities that I had been working on as a public health student and med student. And the scene there really was, Dr. Chaudhary was the founder of the Child in Need Institute. folks who are living in huts on the coast who have very little. This organization is trying to give them basic needs of food, education, and the cyclone, active nature is coming upon them. They're rushing into the one shelter, packing in during COVID, no vaccines, an uptick of COVID cases at that time. Do you go in and pack in and risk getting COVID? Do you stay outside? These are impossible choices. And I picture the children and the families that have to try to negotiate this. And again, of course, they are living on the front lines of these threats. Cyclones have always been a part of these areas and the Bay of Bengal area, but climate change is making it worse. And they have to rebuild after all this happened. The whole community really got wiped out. All the health services really got decimated and had to be rebuilt. And they have to rebuild only to stand the risks of the next extreme weather event. So it really is a global health inequity turbocharger. So look, I think we need to embrace the work of transfer. I have a sneeze coming on here. It's going away now. We have to embrace the work of transformation. These are slides here of climate solutions that I get so excited about. I picture the world in which we implement this with urgency and ambition, and it's health all over the place. Healthier food, healthier air, healthier water, rich, vital forests with biodiversity that's mitigating against the risks of the next pandemic because we're not eating into natural spaces and getting closer to zoonotic viruses. Having our buildings be truly healthy and getting the things out of our building, which we'll talk a little bit more about, that's making us really, really sick. And so there's an element to climate change that it's hard to see. To be honest, I think it's still hard to see. Today, it's pretty cold here in Boston, and there's a lot of needs my patients have. So there is a reason we react to the things that are proximal and immediate in healthcare. We see suffering, we want to address it, but we've got to stay rooted in an understanding of the ways in which how we treat nature is fundamentally, I believe, is the most important driver of how people stay healthy. And if you do this deep work of investing in our planet and really thinking of our built environment and doing it right, America is getting, our life expectancy, our, the gains on health, in spite of all the miracles of medicine and the extraordinary work of health professionals to take care of people's health, we still are not a very healthy country. And so we've got to think about these deeper issues. We're not going to unlock the possibilities of health unless we really reassess our food systems, how to get air pollution down, how to, be thinking about our built environments and our natural spaces and changing that. So some lessons I've learned is that you got to keep your eyes open to a new understanding of the world and its needs. Whatever you care about in medicine, climate change plays a role, and know you're part of a vast team. So, I think there's this feeling we are working so hard. Everyone who's listening today is a very busy person, attending to a lot of needs, attending to their patients. It can feel really hard to just, take one step forward. But I really believe it's important for us to do something small, but persistent over time that'll allow us to be a part of this work. So let me just say a few words about what solutions could look like. These are some questions I always offer to a group is, what systems do you want to change? What communities do you want to be a part of? Where do you find your power, strength, and inspiration? What roles can help you be effective? What issues do you want to spotlight? What world do you want to build and why? And so I think so many of us feel we're trying to take care of our patients and the systems are not right, whether it's our healthcare system and it's too many patients and patients are too sick, or our planetary system, and realizing that people without these basic needs properly addressed are not going to be healthy no matter how good of clinical care we provide. So I think thinking about sustainable healthcare systems, which Idaho and the groups we've been working with have been doing such great work on, building community, we should not understate the importance of that. I am very policy oriented and think that it's really critical that we put the right people in place so that climate policy is at the forefront. I think writing and storytelling about why this matters to us matters a lot. And as Ethan mentioned, we have a public narrative and community organizing fellowship that a few folks in Idaho have taken, and that feels really important. Again, this is really rooted in storytelling, relationship building, power analysis, and understanding, why change hasn't happened and what we can do about it. And just, as a primary care doc, I got to put this slide up, but even more than climate scientists and WHO and the EPA and mom and dad, you see on the left here that doctors are a really trusted voice, maybe the most important and trusted voice in explaining the impacts of global warming and climate change to the public. I tried to brag to my son. I was on the front page of the Boston Globe back in January. We got a curriculum approved at Harvard Med School. I was trying to show off to him a little bit, but he just thought I looked weird in this picture. So I was still looking for his approval here. But I think education is a really important piece of this. We've got to make it a part of our professional responsibility. This is about really good medicine. How we should be dosing diuretics on very hot days, how we should be thinking about outreach to our pregnant patients, on poor air quality days or heat waves. There's a lot that's not, this isn't like extra stuff. This isn't like luxurious stuff. This is about doing our jobs, in medicine and really doing it well. And it's got to be embedded into the way we learn about medicine. Of course, decarbonizing hospitals and the healthcare sector is really important. 8.5% of emissions in the U.S. are from the healthcare system. HHS, many of you have been involved in this, has this pledge now, which has taken off. A lot of hospitals have really signed up to decrease their emissions by 50%, have a senior leader in place. And I really think Idaho, many of the hospitals are really putting some real commitment to sustainability. And then I won't go through all of this, but Ethan mentioned some of the policy roles I've played. I've just found that in policy spaces, decision-making spaces, health professionals are often not represented. And what that means is that our patients are not represented on decisions that fundamentally impact their health. All right, so let's go here. So I want to speak maybe for about 10 minutes or so about my little journey in our home, about becoming an all-electric home. And I'll say a few things. One, I just totally recognize there's a lot of privilege in being able to do this. I was able to put a lot of thought, save money, spend a lot of time to think about how to do this. This has got to be the easy option for everyone and the cost-effective option for everyone. And so I recognize all of that. I also want to say up front that, it feels really good to have an all-electric home now, and it's something we feel really proud of and feel good about. And we did it for health and for the climate. But I also just kind of want to make the point that it's a little bit boring also. So the reason I say that is, like, at the beginning when I did this, there was like a mental, like conceptual, like, ooh, how are we going to do this work? It's going to be so much work. It's like, it felt like a futuristic, like, leap of faith to do an all electric home, because I was just so like, will it be okay in the winter? Will it work? Will it be, I just got to tell you, I just don't think about it. It's just very normal, and it's better, than what we had in terms of kind of comfort and stuff in the home. But, there's definitely some coordination and some work to be done to kind of, be able to do this. People can go at their own pace, but it felt good to get that gas meter out. You can see on the bottom right there. And again, it's just like, I was so hung up on, if I don't do this right, it won't work and stuff like that. And honestly, I want to alleviate some whatever concerns people might have of like that mental leap for it, because it really is just like, it's just the same house now, and it's just in the background, and it feels really good that the pollution is out. So just a few studies about indoor air pollution. We usually talk about outdoor air pollution, up to 9 million, 8.7 million lives are thought to be curtailed, shortened because of air pollution every year, striking 1 out of 5 premature deaths associated with air pollution. So I think about outdoor air pollution a lot, but indoor air pollution is really important. And actually, we're exposed to more indoor air than outdoor air because we spend most of our times indoors. And there's so it's really important this was a study from Chu showing that 78% of air pollution exposure was indoor, but it's also unregulated. The Clean Air Act has done a really extraordinary job, actually, over the last 50 years plus of regulating and improving outdoor air quality, but the EPA has no mandate to address indoor air quality. And so what are some of the pollutants? I'll touch upon some of these, but nitrogen dioxide, really important, especially for our children. Of course, most understood for its impacts on respiratory disease and asthma, but also impacts cognitive function and also thought to impact cardiovascular impacts. So pollutants like nitrogen dioxide got to be at the forefront of our mind. Here is a meta-analysis that came out a long time ago, but is often referenced, that children in homes with gas stoves have a 42% increase of a one-time asthma symptoms and a 24% increased risk of a lifetime asthma diagnosis. And I found that a striking number. This was a study that came out earlier this year that brought a lot of attention, but 12.7% of asthma cases nationwide could be associated with exposure to gas stoves. And then these are a few studies that came out from Stanford. The top one is from Sea Change from Boston here, my group. The second one is Stanford, but 21 toxins were found by measurement in the top study. And the second study showed that if you have your gas stove on for 45 minutes, it has as much benzene pollution as secondhand smoke. So I'm trying to make the point here that, this stuff can feel invisible to us and it's just in the safety of our homes, but there's really stuff that impacts health and the planet here. There's another Stanford study that was showing that 3/4 of methane leaks occur even when the gas stove is off. So methane, of course, really important, 30 times more potent than carbon dioxide in heat trapping in the first 20 years of emissions. And it's just leaking this stuff out into the atmosphere. You've got the central pipe just coming right into your home and leaking methane and these pollutants. I'm not going to go through all of this, but I just wanted to just signal, I think the Rocky Mountain Institute, RMI, has done a really good job on this indoor air quality stuff. So these are different pollutants here on the top that you can see and what organ systems it impacts and what kind of long-term harms that they can cause. So there's a lot of stuff, and you can kind of bring it back to the different devices and appliances in your home and could be a part of your consideration of where some of these things play. So our journey. So we, started with solar panels. This was back in 2018. And some things to consider was just that, if you have an old roof, the ideal is that you have a relatively new roof. And as it turned out, our roof was very old when we bought our home. So we had to redo our roof and then put the panels right on afterwards. And then, finding the right contractor. So doing homework here, we did some of our research here, which obviously will be different in Idaho, but found a company that we really liked. They did an assessment to understand how much energy we were using. And then, we wanted to get an electric car, so we knew we were going to use some more energy. So they put a few extra panels on, assessed, where on the roof would be most effective to pull in the solar energy. And they were just really smart. They just had all the mapping and diagramming of it all, explained it all to us really nicely. It was a quick install. It was actually quite easy to do. And listen, there was an upfront cost to this, no question. But within 7 years, it'll be paid off, and then we'll have free. We won't have an energy bill into the future because we'll be getting that. So, and this was all pre-Inflation Reduction Act. So, there's that piece of, and again, policy has to make this easier for everyone. But there's an upfront cost that actually long term is economically, financially, a really positive thing on the wallet. And then home electrification. So we waited a few years on that. Honestly, I was trying to sort through it and trying to understand how to do it right, and a few babies in the middle of it. So we had to pause on home renovation work, and then came back to it last summer. So not this past summer, actually, a year and a half, summer 2022. And so here's the ways I think to think about it is I think the hardest part is just that electrical work. So it's not that hard to pull out your gas stove and pop in an induction stove. By the way, the induction stove is way better. It just cooks better. But the electrical work is something you got to think out. You got to have a panel that's, updated and ready for it. You've got to have the right outlets to the right places. That's the place where you got to get into the walls a little bit. And that's the hardest piece. And so what I would really say is having someone who's able to see the big picture as a contractor. We went with Boston Standard Company and read about them. There's a New York Times article about some of the work they were doing. They were really great. We explained exactly what I wanted to do. They needed to have a vision of what piece goes first. There was a little bit of, you got to do this and then that, sequencing it properly. But I think that electrical work was, the most, intensive part. But then, the heat pumps getting popped in. I just really want to say heat pumps are so great. I'm not remembering the utilization of heat pumps in Idaho, but many parts of the country, like heat pumps are the norm already. On the East Coast here, a lot of folks are using the gas furnaces, which is the greatest source of emissions from homes, the gas home warming furnace. So, if I had to say one thing that does the best, impact on the climate, it would be getting rid of the gas furnace and getting heat pumps. Heat pumps are great because now, it warms our home and it gives us cooling in the summer. They're not a really good term, the heat pumps, but they're air pumps really. And we didn't have AC in our home before, so we have both now. And then the water heater, this is just something I don't think about at all. The water heater now is a heat pump water heater. So it pulls in heat around our little closet in our basement. It pulls the heat in, warms the water from that, has an electrical backup. So it can use electric if there's not enough heat around it, but it's mostly using the heat pump. Warms our water. I turn the water on. I don't think about it. And then we just got rid of our gas-driven clothes dryer and put an electric in. So, one way to think about it is just to march through the appliances that have gas and think about how to replace it. And of course, just having the right electric ductwork to be able to do that. So again, we had Boston Standard come in and do that work. And again, they were, they started with the electrical work. There was some electric work outside the house. Inside the house, they had to do heat pumps went in within a few days. They just popped out the old gas water heater and put in the new one. And then, once the electrical work was done, we just, the stove and the clothes dryer was just popping it in, and then just plugging it in. I felt very fixated on getting the right induction stove. There's plenty of them now. I will mention just offhand, if, doing the whole package here feels like too much, folks can use an induction stove that's just a little, a plate, that you just plug in on your kitchen surface, and you can use that. Of course, the gas stoves are still leaking and stuff like that, but you can use an induction stove anyway. And it all finished within a few weeks. I wrote 3 weeks here, but actually I think it was 2 weeks. The one piece that took a while is we needed a new utility line to our utility pole. That was just a utilities issue. Everything was like done inside the house, but we had to wait like 2 months for that. So that was a little annoying. But then once they updated that line, we clicked in, and that was it. So I'm just going to close here. Hopefully, I get this in a few minutes, and if there's any questions, I'd be happy to field that. But look, I'm going to come back to the story of despair and courage. I do think that if anyone hasn't. I like probably the person I respect the most in this work is Christiana Figueroas, who was the lead of the UN Paris Agreement in 2015, is a Costa Rican diplomat whose father was a president of Costa Rica, just like a really extraordinary woman who I think because of her Paris Agreement came to be. And she is able to elevate the conversation to this realm where it is really about our relationship to nature, to each other. There's this philosophical foundation. And I just listened to this podcast she was on Being with Krista Tepper. I just listened to it this last weekend. It was so good, and she was able to navigate all the hope, all the despair, be very real, and just say that this is a story, this is an exercise of uncertainty and concern and how to birth a new world. a lot of what we have experienced for much of our lifetimes, that world will not exist in the future. That is just clear. And there's going to be a lot of pain points and a lot of harm, and also a tremendous amount of opportunity. And we've done things really wrong for a long time. And if we do these things right, it will completely fundamentally change the story of health around the world. We will be making so many lives better and healthier by doing this foundational work right. So with that, some sources for courage for me, because of within all the bad news, there is a lot of transformation happening. So this very busy slide on the left, you'll see this is global capacity energy source additions. Okay, so what was being installed for energy sources in 2007? 46% coal, 21 gas, 14 hydro, 10 wind. Can't read how much solar is in yellow. Flash forward to 2021. 4% coal, 11 gas, 7 hydro. Hydro, of course, is really good and clean. 25 wind, 50 solar. So look at that. In 2021, 82% of global installations, energy projects were clean. I think it should be literally 100. Like, I literally believe we have enough fossil fuel on the grid. We need to fully be building out clean energy and slowly ramping down, like steadily moving down our fossil fuels to get to zero. Here's electric vehicles. This is exponential growth. We talk about the S curves, and the world is in an S curve right now of how many electric vehicles are coming across the world. This is the Inflation Reduction Act, which I think is a really important. I think it mattered a ton. The green is what was passed. I feel very anchored in this principle of decreasing our emissions 50% by 2030. And the Inflation Reduction Act promises to do about 40%. And one federal bill to be able to push that. We still need to build all these transmission lines, and we got to build good things faster. We've got a real problem with that. We're having a problem with offshore wind here in New England. I'm from California. High-speed rail has been a real challenge. So this doesn't answer everything. We got to get better at building good things, but this has created a clean energy economy where incentives are in place to buy heat pumps, to buy solar panels. The EPA has put regulations in place that are now being reviewed and open for public comment, so are not been finalized, but the EPA is saying that they're going to put regulations in that by 2032, 2/3 of all cars are electric. They also said by 2040 that all power plants need to either cap all their emissions or be clean energy. So there should not be any emissions out of the power plants by 2040. And then Biden also put an executive order to put environmental justice in the middle of all this. Here's a study about tree canopies that came out in Europe earlier this year, saying if you increase tree cover in cities to 30%, 30 urban spaces, 30% have tree cover, you can decrease temperatures by 1.3 degrees Celsius and decrease premature deaths attributed to heat islands by 1/3. That's wild. Indigenous folks, again, I think we've got to have nature-based solutions. We've got to have wisdom here. In spaces that Indigenous people live, those are 24% of land masses across the world. Those spaces make up 80% of the biodiversity in the world. And there's been modeling that suggests that maybe, even with the commitments we've made so far, we could get to 2 degrees Celsius. Again, 2 degrees Celsius is not success. There's so many harms baked into 2 degrees. To 1.2 where we are today, we're seeing the harms. But if we can abide by our Paris Agreement commitments of 1.5 to 2 degrees Celsius, we've got so much more work to do. I'm hoping in Dubai, I'm going to be going there this year for the first time to a COP conference. We've got to ramp it up. So some of the things that they're really pushing is tripling renewables by 2030 to increase energy efficiency by doubling it, and to have a real language about a phase down of fossil fuels. So those are the goals of the conference. But I'll just close here again. I think climate change is about relationships to the earth, each other, future generations, about our interconnectedness and common humanity and taking care of each other. And so the health voice in this really matters. We cannot make solar panels, we cannot make electric vehicles or rebuild our our towns to be more sustainable. We don't have those skill sets, but we are, I think, one of the few voices that can put the human face in front of all of this. And to be very frank, like we can offer a moral compass here to talk about our children, to talk about their health, to explain the data, and to articulate the reasons why we need a different kind of future. Here's where we are for the US in terms of our emissions. So you can see us bumbling around over the last 22 years or so. We're slowly going down. You can see in the light blue first Copenhagen and then Paris agreements. Again, that's that 50% reduction by 2030. And I don't know about you, but for all the things we have not done, I see that market where we need to get for 50% reduction, and that is completely possible. We have not put ourselves into this work the way we can through policy, and that's starting to happen. And of course, we can meet that mark. There's no question. And so together, we can kind of be pulling this arc together. All right, I'm going to stop there. Thank you so much. And I think we have maybe just a few minutes if people have questions.
Thank you so much, Gaurab. That was outstanding. I really enjoyed that. A few questions I've got. In a state that prides itself on rugged individualism like Idaho, how do we highlight the inequities that climate change and its impacts are having on those who contributed the least without turning off these people that are actually the decision makers?
Yeah, and I appreciate that, and I think Ethan, through our fellowship and all that, to really appreciate, these stories and conversations and how to negotiate in different communities across the country are really different. And I learned a lot, from our fellows in Idaho, like how to navigate that. And we have groups in Kentucky and, Texas. And so I really respect that how we talk about this. We have to bring people together in this. And this is where I would go back to the storytelling craft, and you have got to climate change, like convincing people about climate change. And it's not, I think, usually convincing from 0 to 100. You got to find, number one, those people who are like, okay, maybe on the fence, and then pull them over. I think that's really important. You got to find the right people to try to ally with. But it's about storytelling about things we love and finding shared things. And so, I'm in New England, and I've got my own beliefs about policy and all that stuff. But if someone has a different background than me, I talk about my kids. I talk about being a parent. If I'm talking to my colleagues who feel too busy to do this, I talk about our patients. So you've got to find people's value systems and understand them and what matters to them. In Idaho, the extraordinary commitment you guys have to land is a really big deal. Ethan, it was Idaho that had the big court hearing and the state constitution and whether people have a right to a clean environment. Is that right?
That was Montana.
Montana, sorry.
But Lori Byron, some of our colleagues in Medical Society Consortium for Climate and Health were witnesses and testified to that trial, and those kids stood up and did an amazing thing.
Yeah, but there's real pride, right, of understanding nature, that frankly we don't have here in Massachusetts. And so it's really the sources of pride, explaining the threats to those things that community takes pride in, and building kind of shared values through that.
Yeah, I would just echo what Gaurab said there and say that one of the very Cliff Notes version of our fellowship, I went into it just thinking I just got to pour more data on people, and if I just give people all these horrifying numbers, they'll be scared enough to do something about it. And that's not really the most effective way to communicate with people. It's telling the story of me, why I'm here, telling the story of us, why we're in this together, and then telling the story of we, how the community can make an impact on things.
Yeah, and giving people really pathways to, being scared is okay. It is scary, and we don't need to sugarcoat that. But we've got to paint the picture of what positive change can look like. I think actually there's a lot of storytelling that is just rooted in freaking people out. And Catherine Hayhoe, I hope she spoke about that. I think she's the voice in this of like giving people agency is really critical in that.
So a question from the audience. Oh, go ahead, Stephanie.
I just want to, one question online I thought was really great was, Dr. Basu, it was about the work you did at your house, and financially, all these changes that you discussed may be unattainable to some. What is
Yeah.
one thing that could be done that makes the biggest difference?
Yeah, I mean, and again, I really recognize that, and that's real. And I would just say again, Rewiring America is a really awesome resource. So with the IRA, major incentives now for a lot of them. So I would actually not dismiss that having heat pumps and all that may be the best financial option. So check out things like Rewire. They do a calculator for you, and you can think about what works for you. But it's real too, that we again need policy that's putting all this stuff into place, and it can't be on people's backs. But I would say I really feel like the heat pump is the biggest thing. Getting the gas furnace out of the house is important, and it's the biggest cause of emissions. So from a climate perspective, I think the heat pumps decrease the emissions of a house most. The gas stove is interesting, is that decreases air pollution the most because of the venting of the furnace. It vents a lot of the pollutants out. But the gas stove, even with a vent, a lot of people don't have that oven vent, but even with those, the things I was describing about asthma and the other impacts of the pollutants. So from a health inside the house, stoves probably is the most important.
And just
Great.
a plug for our next lecture in January. We are going to have speakers from Idaho Power, as well as the city of Boise, and from a private company called Acclimate, that are going to talk about specific incentives and what you can do in Idaho, and some other programs that are available to us locally in terms of trying to clean your home. So stay tuned for that. That's coming up in January. Another question from the audience was about indoor air quality in other lower income workers, like people working in fast food. Is there evidence that looks at health impacts of the increased temperatures and degraded air quality in a fast food kitchen, and how that impacts people's long-term health?
It's like a really great question. You can even think about, a lot of these restaurants have these huge gas, stoves, and I have not seen that. I don't know if anyone else has seen it, but I think that's actually a really good research question. You could be measuring air quality, in kitchens, and yeah, again, these are all intertwined of people. If you got a job and you're just getting your legs in a job, like you can't be decrease my environmental exposures. You're not empowered to really say that, whether it's that situation or the patient who was a farmer I was speaking about. So that's again why we need to have occupational health policies that really protect people against this. But great question.
Okay, well, we're a few minutes over. I want to thank our great speaker, Dr. Basu, for an outstanding talk, and thank all of our attendees for coming out and hearing about things. We'll be back in January. I believe it's the second Wednesday in January with our next talk. Stay tuned to the Idaho Clinicians for Climate and Health website. St. Luke's Sustainability will be sending out some reminders to people to re-sign up. Thank you, Dr. Basu. Lovely talk.
Thanks, everyone.